Hello, my name is Ruben Mesa, and I'm the Executive Director of the Mays Cancer Center at UT Health San Antonio MD Anderson. And speaking today a bit of how symptoms for patients with myeloproliferative neoplasms help to inform treatment decisions. So first, we have learned over time through a variety of efforts that patients with MPNs have a range of symptoms. These can range from symptoms related to enlargement of the spleen. There can be pain, discomfort, fullness, early satiety. There can be constitutional symptoms, night sweats, fevers, fatigue, weight loss, cachexia. There can be symptoms associated with challenges with circulation, such as headaches, difficulties with concentration, erythromelalgia, amongst other symptoms. We've learned these symptoms are tied to the biology of the disease. Can be everything from issues in circulation, issues in blood viscosity with the counts being high, issues of splenomegaly associated with the disease, elevations in a range of inflammatory cytokines that can be attributed to the disease, or issues like itching, which may be at least in part due to white cell migration in the skin for individuals afflicted by the disease. So there are a range of important ties to biology. Now, first, as we think about symptoms informing treatment decisions, first, they can inform prognosis. So in myelofibrosis, symptoms, particularly night sweats, fevers, weight loss, and other cachectic type symptoms, have been associated with more aggressive disease and poorer survival and are included in many other prognostic scores. In terms of understanding the burden of disease, symptoms are very important. In patients with essential thrombocythemia or polycythemia vera, the presence of symptoms, one, contributes to the burden of disease. What is it like for that patient to go day in and day out with that disease? How does it impact their activities of daily living? We've done research that shows that symptoms have a straight tie-in to the quality of life that patients experience, particularly the health-related quality of life, and that it's important that they be addressed. Symptoms can be associated with disease progression. Early on in the course of disease, patients may have a spectrum of symptoms, particularly with ET or PV, pruritus, fatigue, headaches, difficulties with concentration. But if the disease is progressing toward myelofibrosis, we could see the development of weight loss, night sweats, fevers, bone pain. Particularly things such as bone pain and fevers clearly associated with more aggressive disease, both into myelofibrosis, but potentially even progressing towards acute leukemia. Now, how do they impact treatment? Well, one, they can impact the decision to initiate treatment. If an individual has ET or PV and is managed with aspirin with ET or PV with phlebotomy, but really has uncontrolled symptoms, that can be an indication for starting cytoreductive therapy. We know that the normalization of counts sometimes can have a big impact with difficulties such as erythromelalgia, headaches, difficulties with concentration. Erythromelalgia also can benefit sometimes from aspirin therapy, and sometimes we increase the aspirin therapy, or use it twice a day, if not present. We know that symptoms can be a reason for failing hydroxyurea, particularly in polycythemia vera, and can be an indication for the consideration of therapies such as ruxolitinib approved in the second-line setting for polycythemia vera. Sometimes the symptoms, if better on ruxolitinib but not adequately controlled, can also have implications in terms of increasing the dose of ruxolitinib. In myelofibrosis, the importance of improving symptoms is a cornerstone of our therapeutic approach. It is not agnostic to counts, splenomegaly, or progression, but is an important component. So one, it can be important in terms of initiating therapy. Lower risk patients, but who are very symptomatic with myelofibrosis, will benefit from therapy, and frequently that can be ruxolitinib or a JAK inhibitor. That could also include fedratinib. That could also include individuals who have thrombocytopenia and benefit from pacritinib. We know that symptoms can be important in terms of our modification of dose of JAK inhibition, now with the approval of ruxolitinib, fedratinib, and pacritinib. We know that being able to use full dose JAK inhibition is important in terms of improving symptoms. Patients with thrombocytopenia in the past, we had to modify doses of ruxolitinib because of thrombocytopenia, and that can be an indication for consideration of pacritinib, especially with a platelet count of under 50,000, but even under a platelet count of under 100,000. Momelotinib may be soon approved off the basis of the MOMENTUM study, which can help to improve symptoms, anemia in the second-line setting for patients with myelofibrosis as well as splenomegaly. And again, may allow full dose usage for individuals that have been previously modified dose of ruxolitinib due to anemia. So symptoms are important in patients with MPNs. They're present, they can have prognostic value, they're tied to the biology of the disease. They can be important in terms of the initiation of therapy, modification of dose, or even changing therapy. Indeed, this window of insight into the subjective challenges that patients experience is an important aspect of managing patients with MPNs. Thank you.